Welcome again to the Invisible Science of Smiles. It's Dr. Diana Bueno Toro here. Today I want to focus on what a dental visit can reveal and restore. I would like to approach this with a couple of stories, real cases that we have seen in our practice, so it's easier to understand. A lovely woman in her 40s came to see me because she had pain in an upper tooth, but what we found was a massive cyst in her lower jaw around an impacted wisdom tooth. It was so large we had a concern that her jaw could fracture. She thought she had one sore tooth. What she actually had was a serious hidden pathology. And that is why I say this. A visit to the dentist is not always just about teeth. Most people think of dentistry as a clean, a filling, a broken tooth, or a bit of pain. But over the years, we have seen patients come in for something small and they leave having discovered something far bigger. In that first case, I examined the upper tooth very carefully, but I could not clearly reproduce the symptoms that she was having. Still, something did not feel right. So I recommended, come on, let's do a 3D scan. And when we saw that scan, everything changed. The issue was not the upper tooth at all. It was that cyst in the lower jaw associated with that wisdom tooth, which has been lying flat under the gum for many years, and it required major surgery. That patient came in for discomfort, but she left with a diagnosis that may have prevented a catastrophe. But that is not the only time that I have seen dentistry uncover something deeper. One of the dentists working with me once noticed abnormal jaw growth in an adult patient. That is not normal, of course. Our jaws should not continue growing over time. That observation led to further investigation, and eventually the patient was diagnosed with a brain tumor. Every time I see him, he tells me the story because it saved his life. In another case, a patient that I have been seeing now for 5 years, I suggested for him to visit his GP because during his dental assessment, I was concerned there were broader health issues that I considered they needed further investigation. When the patient came 6 months later, he told me that he has been diagnosed with diabetes, a serious heart problem that was very close to becoming a major event, and also was diagnosed with sleep apnea. So yes, sometimes a dental visit might be about a tooth, but sometimes it's the first place a hidden problem is noticed. The oral cavity can show early symptoms that can help us think outside the box and suggest further investigation. These signs or symptoms may be part of a much bigger picture. In another case, a patient that I have been seeing now for over 5 years, I suggested for him to visit his GP because during the dental assessment, I was very concerned there were broader health issues that needed investigation. When the patient came back 6 months later, he told me he has been diagnosed with diabetes and a serious heart problem that was very close to becoming a major event. We also diagnosed the patient with moderate sleep apnea. So yes, sometimes a dental visit is about a tooth, but sometimes it's the first place a hidden problem is noticed. You see, the oral cavity can show early symptoms that can help us think outside the box and suggest further investigation. These signs and symptoms may be part of a much bigger picture. A couple of weeks ago, I recorded a podcast with Dr. Warwick Bishop, and he shared a fascinating story about a patient whose atrial fibrillation had never been fully controlled. And he commented that he seems to have problems in the oral cavity. And after periodontal treatment was done, it normalized, and he was very surprised. Now, I want to be careful here, because I don't mean at all that we should make simplistic claims and say, oh, gum treatments are going to cure heart rhythm problems. But it does raise a very important question. What role the oral chronic inflammation play in the body? What happens when gums are inflamed, bleeding, infected, and they are leaking, increasing the inflammatory burden into the system for years? These are not trivial issues. The mouth is not separate from the body. It is connected to inflammation, it is connected to breathing, it is connected to sleep, it is connected to how we eat, how we function, how risk builds over time. But this is only one side of dentistry, because dentistry does not only reveal what is hidden, but it also can restore what has been lost. Let me tell you about another patient, and this patient is very close to my heart. I saw this lovely woman who had previously had a full upper arch rehabilitation, and it was done several years ago. She had several crowns in the upper jaw and also had a bridge. And after that treatment, well, she stopped going to the dentist because she thought, everything has been done, and she thought that she didn't need to come anymore. Then when she came to see me, she came because something felt wrong. She told me that she has developed a lisp and she didn't like it. And she was feeling sometimes pain. And that was the beginning. When I examined her and we took the x-rays, they were showing signs of caries and some infections. But we couldn't see the whole scenario until we removed the whole work. We had to do this because all the crowns were together as a single unit, and there was one tooth that we couldn't save. So we need to remove the whole thing. At that point, we did not know what we were going to find underneath, and we didn't even know if we were going to be able to save her teeth. This is what I often call the Pandora's box, because when all dentistry comes off, sometimes the truth underneath is very different for what the outside suggests. But to her credit, she chose to go ahead and have everything done. In the end, she needed to do everything, but on a combination of different treatments. We had to do crowns, we had to do implants, we had to do root canal treatments, gum therapy. It was quite a complex treatment to redo everything that got damaged over that time. It was a major journey for her, but it doesn't mean that there are no risks associated to the new treatment. But that now she understands that she needs to be involved, and those risks need to be managed. When it was finished, everything changed for her. She doesn't have pain anymore. And the lisp, which is what brought her here, disappeared. And she doesn't have any more hidden infections. This result was great, considering the damage and the amount of treatment needed. But the part that I love the most, and stayed with me, is this. When I saw her for her review, she told me her grandchildren said to her, "Grandma, now you have very nice white teeth, beautiful teeth, and you look so beautiful." And that made her day. And it made mine too, because she was happy and I could see it in her eyes. And that is the part people often miss about dentistry. Sometimes we are not just treating teeth. Sometimes we are removing pain, we are removing infection. Sometimes we are restoring the speech or rebuilding the chewing function. But many times we are giving someone back their confidence, that confidence that they had quietly lost. But now, talking about what people have lost, missing teeth have become one of the largest oral problems. Problems such as inability to chew, damage to other structure, the teeth, the gums, the joints, the bone, the muscles, etc. Sometimes it can be quite limited, and it can have a mental impact in patients. So this is where implants can be a solution. For many patients, implants are not luxury. They make the difference between coping and functioning normally again. They can restore stability, they can restore chewing, comfort, and having trust in the mouth again. Cosmetic or restorative dentistry, when it's done properly, is about restoring the harmony to a smile that has been damaged by wear, infection, collapse, trauma, or time. So when I say a visit to the dentist can transform health, I mean it in two ways. Sometimes it can reveal what is hidden, a cyst, a suspicious pattern, a deeper medical issue, a disease process that wasn't expected and we didn't know that it was happening. And sometimes it restores what has been lost. It restores the comfort, the function, the confidence, the beauty, and quality of life. This is why dentistry is so much more than what people think. So the next time that you think about a dental visit, do not reduce it to a clean or a filling. It is your health, your longevity, and your quality of life. Stay tuned, because in our next episode, we are going to talk about one of the most important tools we use to help us see what may be driving disease. But in the meantime, take care, stay healthy, and if you haven't subscribed to our channel yet, make sure you do, so you don't miss the next episode. If you want to find more information, you can check our website at www.vipdentalclinic.com.au. Bye bye for now.